Question 1. Market research demonstrates a growing patient interest in teeth whitening services. A patient presents to the dental office requesting a brighter smile and inquires about various whitening options, including professional in-office treatments and over-the-counter products. As a certified restorative dental assistant, CRDA, what is the most appropriate initial action to take in response to this patient's request? Adhering strictly to CRDA regulatory frameworks. Option A. Consult with the supervising dentist to assess the patient's suitability for whitening, confirm the appropriate treatment protocol, and receive specific instructions for the CRDA role in the procedure. Option B. Immediately recommend a popular over-the-counter whitening kit that has shown good results in general consumer reviews, explaining its ease of use. Option C. Advise the patient that teeth whitening is outside the scope of practice for a CRDA and that they must consult directly with a dentist for any such aesthetic concerns. Option D. Proceed with preparing the patient for an in-office whitening procedure, assuming it is the best option for immediate results, and begin the application of whitening agents as per general training. Correct answer is A. Consult with the supervising dentist to assess the patient's suitability for whitening, confirm the appropriate treatment protocol, and receive specific instructions for the CRDA role in the procedure. Explanation. This scenario presents a common challenge in restorative dentistry, where patient demand for aesthetic treatments like teeth whitening intersects with the CRDA scope of practice and regulatory limitations. The CRDA must navigate patient expectations, the specific protocols for in-office and at-home whitening, and the legal boundaries of their role in dispensing and supervising these procedures. The challenge lies in accurately assessing the patient's suitability for whitening, ensuring informed consent, and adhering strictly to the dentist's prescribed treatment plan and the CRDA authorized duties. The correct approach represents best professional practice because it prioritizes patient safety and adheres to the established regulatory framework for dental auxiliaries. By consulting with the supervising dentist to confirm the patient's suitability and to receive specific instructions regarding the whitening procedure, the CRDA acts within their authorized scope of practice. This ensures that the patient receives treatment only after a professional dental assessment, that the chosen whitening method is appropriate for their oral health status, and that the procedure is conducted under appropriate supervision, aligning with CRDA regulations that define their responsibilities in assisting with or performing specific dental procedures under direct or indirect supervision, as dictated by state law. An incorrect approach involving the CRDA independently recommending or dispensing over-the-counter whitening products without dentist consultation represents a significant regulatory and ethical failure. This bypasses the essential dental assessment, potentially leading to inappropriate treatment for a patient with contraindications, e.g., existing restorations, periodontal disease, tooth sensitivity, which could cause harm. Ethically, it constitutes practicing beyond the scope of the CRDA licensure and violates the principle of patient autonomy by not ensuring informed consent based on a professional dental evaluation. Another incorrect approach, where the CRDA proceeds with an in-office whitening procedure without confirming the dentist's specific instructions or the patient's readiness, also poses regulatory and ethical risks. This could lead to procedural errors, inadequate patient preparation, or failure to manage potential adverse reactions, all of which fall outside the CRDA authorized duties and could result in patient harm and disciplinary action. It demonstrates a lack of adherence to the supervisory requirements mandated by CRDA regulations. The professional decision-making process for similar situations should involve a clear understanding of the CRDA scope of practice as defined by state dental board regulations. When faced with a patient request for teeth whitening, the CRDA should first assess if the patient has had a recent dental examination. If not, or if there are any concerns about the patient's oral health, the CRDA must consult the supervising dentist. The dentist will then determine the patient's suitability, prescribe the appropriate whitening method, in-office, take-home professional kit, or advise against it, and provide specific instructions for the CRDA role in the procedure. The CRDA must then execute these instructions precisely, ensuring proper patient education, consent, and adherence to all safety protocols. Question 2. Analysis of a scenario where a dentist is preparing a tooth for a composite restoration and requires an instrument to carefully detect the presence and extent of enamel and dentin caries. The dental assistant is presented with several hand instruments and must select the most appropriate one for this specific diagnostic purpose. Which instrument is best suited for this task? Option A. An explorer with a fine, sharp, and angled tip designed for tactile detection of surface irregularities and carious lesions. Option B. An excavator with a sharp, spoon-shaped tip used for removing soft carious dentin. Option C. A periodontal probe with a blunt, calibrated tip used for measuring the depth of gingival sulci. Option D. A dental mirror with a reflective surface used for indirect vision and retraction. The correct answer is A. An explorer with a fine, sharp, and angled tip designed for tactile detection of surface irregularities and carious lesions. Explanation. Scenario analysis. This scenario presents a common challenge in a dental practice where a restorative dental assistant must select the appropriate hand instrument for a specific clinical task. The challenge lies in accurately identifying the instrument based on its design and understanding its intended use within the restorative procedure, while also adhering to infection control protocols. Misidentification or incorrect use can lead to procedural inefficiencies, patient discomfort, and potential damage to tooth structure or restorative materials. Correct approach analysis. The correct approach involves a thorough understanding of the morphology and function of various dental hand instruments, specifically explorers and probes. The ability to visually distinguish between these instruments and recall their primary applications is a core competency for a certified restorative dental assistant, CRDA. This knowledge ensures the assistant can anticipate the dentist's needs, select the correct instrument promptly, and contribute to a smooth and effective restorative procedure, aligning with best practices for patient care and operational efficiency. Incorrect approaches analysis. Selecting an instrument based solely on its perceived sharpness without understanding its specific design and intended use is a significant failure. Explorers are designed for tactile detection of caries and irregularities, while probes are primarily for measuring sulcus depth. Using an explorer for probing can lead to inaccurate measurements and potential trauma to the gingiva. Conversely, using a probe for caries detection is less effective due to its blunt tip. This demonstrates a lack of fundamental knowledge regarding instrument identification and application, which is a direct violation of professional standards expected of a CRDA. Choosing an instrument based on its similarity in handle design to a previously used instrument without confirming its specific tip configuration is also problematic. While handles may share similarities, the functional tip is critical. This approach relies on guesswork rather than informed selection, increasing the risk of using the wrong instrument for the task. This reflects a failure in meticulous attention to detail and a disregard for the precise requirements of restorative dentistry, potentially leading to procedural errors and compromised patient outcomes. Opting for an instrument that appears clean, without verifying its specific type and intended use, is a critical lapse in judgment. While cleanliness is paramount for infection control, it does not guarantee the instrument's suitability for the task. This approach prioritizes a superficial aspect over the functional requirements of the procedure. It indicates a lack of understanding of instrument differentiation and their specific roles in restorative procedures, which is a fundamental expectation for a CRDA. Professional reasoning. Professionals should approach instrument selection with a systematic process. This involves 1. Understanding the specific clinical task being performed. 2. Recalling the characteristics of instruments designed for that task. 3. Visually identifying the instrument based on its tip design and overall morphology. 4. Confirming the instrument's identity and intended use before presenting it to the dentist. This methodical approach, grounded in comprehensive knowledge of dental instruments and their applications, ensures accuracy, efficiency, and patient safety, upholding the standards of the CRDA certification. Question 3. Quality control measures reveal a visible particulate contaminant on a critical dental instrument immediately before it is to be used in a patient procedure. What is the immediate and most appropriate action for the Certified Restorative Dental Assistant, CRDA, to take? Option A. Discard the instrument in the regular waste bin and retrieve another instrument. Option B. Attempt to wipe the contaminant off the instrument with a sterile gauze pad and proceed with the procedure. Option C. Remove the instrument from the patient's immediate vicinity and initiate the full sterilization process according to established protocols. Option D. Proceed with the procedure using the instrument and inform the dentist after the procedure is completed. The correct answer is C. Remove the instrument from the patient's immediate vicinity and initiate the full sterilization process according to established protocols. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the Certified Restorative Dental Assistant, CRDA, to balance immediate patient care needs with strict adherence to infection control protocols. The presence of a visible contaminant on a critical instrument necessitates a decision that prioritizes patient safety above all else, while also considering the operational impact of delaying treatment. The CRDA must exercise sound judgment to prevent potential harm without causing undue disruption to the dental practice. Correct approach analysis. The correct approach, which involves immediately removing the contaminated instrument and initiating the sterilization process according to established protocols, represents best professional practice. This aligns directly with the CRDA ethical obligation to protect patient health and safety, as mandated by the principles of infection control and the CRDA scope of practice. Regulatory frameworks for dental assisting, including those governing CRDA, universally emphasize the critical importance of aseptic technique and proper instrument reprocessing to prevent the transmission of infectious agents. Failure to address contamination promptly and effectively would violate these fundamental requirements. Incorrect approaches analysis. One incorrect approach would be to attempt to clean the visible contaminant off the instrument without re-sterilizing it, believing it to be a minor issue. This is a significant regulatory and ethical failure because it bypasses the essential steps of sterilization, which are designed to eliminate all microorganisms. Even a seemingly minor contaminant can harbor pathogens that could be transmitted to the patient or dental team, violating the principle of do no harm and the specific infection control guidelines that mandate thorough reprocessing of all instruments. Another incorrect approach would be to proceed with the procedure using the contaminated instrument, perhaps with the intention of informing the patient afterward or assuming the risk is minimal. This is a severe ethical breach and a direct violation of regulatory requirements. It demonstrates a disregard for patient safety and a failure to uphold the professional standards expected of a CRDA. Such an action could lead to serious patient harm, legal repercussions, and disciplinary action against the CRDA certification. A third incorrect approach might be to discard the instrument without following proper biohazard disposal procedures. While the instrument needs to be reprocessed, its immediate disposal without appropriate handling would be a failure in waste management protocols, which are also part of the broader regulatory framework for dental practices to prevent the spread of infection and protect the environment. Professional reasoning. When faced with a situation involving potential contamination of instruments, a CRDA should follow a clear decision-making process. 1. Prioritize patient safety. The immediate and overriding concern is to prevent any harm to the patient. 2. Identify the contamination. Recognize the presence of any foreign material on instruments. 3. Halt the procedure. Immediately stop any procedure that would involve the contaminated instrument. 4. Isolate the instrument. Remove the contaminated instrument from use. 5. Follow established protocols. Initiate the full sterilization cycle for the contaminated instrument as per the dental practice's infection control plan and regulatory guidelines. 6. Communicate. Inform the supervising dentist and relevant team members about the situation and the steps being taken. 7. Document. If necessary, document the incident and the corrective actions taken. This systematic approach ensures that patient safety is paramount, regulatory compliance is maintained, and professional ethical standards are upheld. Question 4. Benchmark analysis indicates that a Certified Restorative Dental Assistant, CRDA, is tasked with updating a patient's electronic health record (EHR) by integrating information from a recently transitioned charting system. During this process, the assistant notices that the new system's dental charting is detailed, but the patient's documented medical history appears incomplete and contains some notations that seem contradictory to information previously provided by the patient verbally. What is the most appropriate course of action for the CRDA to ensure compliance with HIPAA and best professional practice? Option A. Proceed with updating the EHR based solely on the new charting system, making a note to ask the patient about the medical history discrepancies during their next appointment. Option B. Complete the EHR update using the information from the new charting system and the existing medical history, assuming the older records may be less accurate. Option C. Manually correct the medical history entries in the EHR to align with the assistant's understanding of the patient's verbal statements without consulting the supervising dentist. Option D. Immediately flag the discrepancies in the medical history to the supervising dentist or authorized personnel, and refrain from finalizing the EHR update until the inconsistencies are resolved and the medical history is verified. The correct answer is A. Proceed with updating the EHR based solely on the new charting system, making a note to ask the patient about the medical history discrepancies during their next appointment. Explanation. Scenario analysis. This scenario presents a common challenge in dental practice, ensuring accurate and compliant patient record keeping when transitioning between different charting systems and dealing with incomplete historical data. The professional challenge lies in balancing the need for comprehensive and legally defensible documentation with the practicalities of managing existing records and the potential for errors during data migration or interpretation. Maintaining patient confidentiality and adhering to HIPAA regulations are paramount, especially when dealing with sensitive medical history information. Correct approach analysis. The correct approach involves a systematic and compliant process for updating and integrating patient records. This includes verifying the accuracy of existing information, cross-referencing with new charting data, and ensuring all entries are dated, signed, and legible. Critically, it requires a thorough review of the patient's medical history to identify any potential contraindications or relevant factors for restorative treatment, documenting any discrepancies or missing information, and initiating steps to obtain clarification from the patient or previous providers. This approach directly aligns with HIPAA requirements for accurate, complete, and accessible patient records, as well as the ethical obligation to provide safe and informed dental care. It prioritizes patient well-being and legal compliance by ensuring all relevant information is captured and understood. Incorrect approaches analysis. One incorrect approach involves solely relying on the new charting system without verifying or integrating the historical data. This poses a significant regulatory failure under HIPAA, as it can lead to incomplete or inaccurate patient records, potentially impacting future treatment decisions and patient safety. It also fails to meet the ethical standard of providing comprehensive care based on a complete understanding of the patient's health status. Another incorrect approach is to ignore or dismiss discrepancies in the medical history, assuming they are minor or irrelevant. This is a critical ethical and regulatory failure. HIPAA mandates that patient records be accurate and complete. Ignoring potential issues in the medical history could lead to adverse patient outcomes, such as allergic reactions or complications from pre-existing conditions, and would violate the dentist's duty of care. A third incorrect approach is to delegate the entire process of reconciling and updating records to an untrained assistant without proper oversight. While assistants play a vital role, the ultimate responsibility for the accuracy and completeness of patient records rests with the licensed dental professional. Failure to supervise adequately can lead to errors that violate HIPAA and compromise patient care. Professional reasoning. Professionals should approach this situation by first recognizing the legal and ethical imperative of accurate and complete patient records. The decision-making process should involve a systematic review of all available documentation, prioritizing patient safety and compliance with HIPAA. This includes 1. Initiating a thorough review of both the old and new charting systems, paying close attention to the patient's medical history. 2. Identifying and documenting any discrepancies or missing information. 3. Consulting with the patient to clarify any ambiguities in their medical history. 4. If necessary, attempting to obtain records from previous providers. 5. Ensuring all updated records are dated, signed, and legible, adhering to established dental charting standards. 6. Maintaining strict confidentiality of all patient information as required by HIPAA. 7. Seeking guidance from the supervising dentist or practice manager if complex issues arise. Question 5. Research into optimizing the workflow for amalgam placement. A CRDA is considering different strategies to enhance efficiency and ensure the quality of the final restoration. Which approach best aligns with the principles of process optimization in restorative dental assisting, considering the need for meticulous material handling and infection control? Option A. Preparing the amalgam, selecting the matrix and wedge, having condensers and carvers readily accessible in a prearranged sequence before the dentist begins the preparation. Option B. Relying on the dentist to guide the selection of the matrix system and wedges, as they have the ultimate responsibility for the restoration's fit. Option C. mixing the amalgam only after the matrix band and wedge have been placed to ensure the material is as fresh as possible when condensed. Option D. Waiting for the dentist to request specific instruments and materials as needed during the procedure, allowing for flexibility in case of unexpected changes. The correct answer is A. Preparing the amalgam, selecting the matrix and wedge, and having condensers and carvers readily accessible in a prearranged sequence before the dentist begins the preparation. Explanation. This scenario presents a common challenge in restorative dentistry, optimizing the efficiency and quality of amalgam placement while adhering to strict infection control and material handling protocols. The CRDA role is crucial in ensuring that procedures are performed safely, effectively, and in compliance with established guidelines. The professional challenge lies in balancing speed with meticulous technique, as any compromise can lead to suboptimal restoration longevity, patient discomfort, or even breach of infection control. The correct approach prioritizes a systematic, pre-planned sequence of actions that minimizes chair time without sacrificing quality or safety. This involves having all necessary instruments and materials readily accessible and organized in a logical workflow. For amalgam placement, this means having the amalgamator prepared, matrix bands and wedges selected and readily available, and the condenser and carvers within easy reach. This organized approach directly supports the CRDA responsibility to assist the dentist efficiently, ensuring proper condensation and carving of the amalgam, which are critical for achieving a well-sealed and anatomically correct restoration. Adherence to these protocols aligns with the CRDA ethical obligation to provide competent patient care and maintain a safe clinical environment, as mandated by the regulatory framework governing dental assisting practice in the specified jurisdiction. An incorrect approach that involves rushing through the preparation of materials or neglecting to pre-select the appropriate matrix and wedge can lead to delays during the procedure itself, potentially compromising the setting time of the amalgam or resulting in a poorly contoured restoration. This not only impacts the quality of the final restoration, but also increases the risk of post-operative sensitivity and secondary caries. Furthermore, disorganized material handling can inadvertently lead to cross-contamination, a direct violation of infection control regulations. Another incorrect approach might be to delegate tasks to an assistant who is not adequately trained in the specific requirements of amalgam placement, leading to errors in material mixing, condensation, or carving. Such a failure to ensure proper execution of the procedure, even if delegated, ultimately reflects a lapse in professional responsibility and adherence to the standards of care expected of a CRDA. The professional decision-making process for similar situations should involve a thorough understanding of the restorative procedure steps, anticipating the dentist's needs at each stage, and proactively preparing all necessary armamentarium and materials. This proactive planning, coupled with a commitment to meticulous technique and strict adherence to infection control protocols, forms the foundation of efficient and high-quality patient care. Question 6. Cost-benefit analysis shows that streamlining the instrument sterilization process could save significant chair time. Which of the following approaches best optimizes this process while adhering to Certified Restorative Dental Assistant (CRDA) standards? Option A. Reducing the number of sterilization verification steps to only a visual check of instruments after the cycle. Option B. Relying solely on the manufacturer's recommended sterilization time without independent verification of the sterilization unit's performance. Option C. Delegating the entire sterilization verification process to a newly hired dental assistant with minimal training. Option D. Implementing a standardized protocol for instrument sterilization that includes pre-cleaning, ultrasonic cleaning, proper packaging, sterilization cycle verification, and documented record keeping. The correct answer is D. Implementing a standardized protocol for instrument sterilization that includes pre-cleaning, ultrasonic cleaning, proper packaging, sterilization cycle verification, and documented record keeping. Explanation. This scenario is professionally challenging because it requires balancing efficiency gains with patient safety and regulatory compliance, which are paramount in dental assisting. The CRDA must understand how process optimization impacts not only workflow, but also adherence to established standards of care and infection control protocols. The correct approach represents best professional practice because it prioritizes patient well-being and regulatory adherence while seeking efficiency. implementing a standardized protocol for instrument sterilization, which includes verification steps and documentation, ensures that all instruments meet the required safety standard before patient use. This aligns with the CRDA responsibility to maintain a safe clinical environment and uphold the integrity of restorative procedures. Adherence to these protocols is often mandated by state dental boards and professional organizations, ensuring a consistent and high level of patient care. An incorrect approach that bypasses verification, steps in sterilization, even if it saves time, poses a significant risk of cross-contamination and infection transmission. This directly violates the ethical obligation to protect patient health and could lead to regulatory violations related to infection control standards. Another incorrect approach that relies solely on visual inspection without proper sterilization cycles or documentation fails to meet the objective criteria for instrument safety and could be deemed negligent. This disregards the established scientific principles of sterilization and the regulatory requirements for demonstrating its efficacy. A third incorrect approach that delegates sterilization verification to an untrained assistant without proper oversight or competency validation undermines the safety of the process and could result in errors that compromise patient care, violating the principle of competent practice and potentially leading to disciplinary action. Professionals should approach process optimization by first identifying areas where efficiency can be improved without compromising patient safety or regulatory compliance. This involves understanding the current workflow, identifying bottlenecks, and then researching and implementing solutions that are evidence-based and align with established best practices and regulatory mandates. A thorough risk assessment should be conducted for any proposed change, and all implemented changes should be documented and periodically reviewed for effectiveness and continued compliance. Question 7. System analysis indicates that a certified restorative dental assistant, CRDA, is tasked with obtaining intraoral radiographs for a patient presenting with a history of gagging and a narrow palate. The available X-ray equipment is a standard intraoral unit with a fixed cone. The assistant needs to select the most appropriate radiographic technique to achieve diagnostic quality images while minimizing radiation exposure and patient discomfort. Which of the following approaches best reflects best professional practice in this situation? Option A. Employ the bisecting angle technique for all intraoral radiographs, as it is generally more adaptable to challenging anatomy and can reduce the need for film placement deep into the oral cavity, thereby potentially mitigating gagging. Option B. Consistently use the paralleling technique for all intraoral radiographs, as it is considered the gold standard for minimizing distortion and is universally applicable regardless of patient anatomy or gag reflex. Option C. Utilize the bisecting angle technique exclusively for this patient, assuming it will always be superior for patients with gagging issues, and adjust exposure settings empirically based on previous experiences with similar patients. Option D. Immediately attempt the paralleling technique, and if the patient gags excessively or the film cannot be positioned correctly, switch to the bisecting angle technique without further consideration of exposure factors. The correct answer is A. Employ the bisecting angle technique for all intraoral radiographs, as it is generally more adaptable to challenging anatomy and can reduce the need for film placement deep into the oral cavity, thereby potentially mitigating gagging. Explanation. This scenario presents a common challenge in dental radiography, where the assistant must balance the need for diagnostic quality images with the imperative of minimizing radiation exposure to both the patient and themselves. The professional challenge lies in accurately assessing the patient's anatomy and positioning needs, while adhering to strict radiation safety protocols and equipment limitations. Careful judgment is required to select the most appropriate technique that yields a clear, interpretable radiograph without compromising safety. The correct approach represents best professional practice because it prioritizes patient safety and diagnostic efficacy through a thorough understanding of radiographic principles and regulatory requirements. Specifically, it involves a systematic evaluation of the patient's oral anatomy, the limitations of the X-ray equipment, and the principles of radiation physics to select the most suitable technique. This aligns with the CRDA responsibility to operate radiographic equipment safely and effectively, as mandated by regulatory frameworks governing dental radiology, which emphasize ALARA as low as reasonably achievable, principles, and the use of appropriate techniques for optimal diagnostic yield. An incorrect approach that relies solely on a single technique, without considering patient-specific factors or equipment capabilities, fails to meet professional standards. This could lead to suboptimal image quality, necessitating retakes and thus increasing radiation exposure, or worse, producing undiagnostic images that could result in misdiagnosis or delayed treatment. Such an approach would violate ethical obligations to provide competent care and regulatory mandates to minimize radiation exposure. Another incorrect approach might involve disregarding the patient's ability to tolerate a specific position, potentially leading to discomfort or gagging, which again could necessitate retakes and increased radiation. This demonstrates a lack of patient-centered care and an insufficient understanding of the practical application of radiographic techniques. A further incorrect approach could be to assume all equipment functions identically, leading to improper exposure settings or angulation, thereby compromising image quality and potentially increasing radiation dose. This highlights a failure to understand the nuances of specific equipment and its impact on radiographic outcomes. The professional reasoning process for similar situations should involve a step-by-step assessment. First, understanding the diagnostic objective of the radiograph. Second, evaluating the patient's individual anatomy and any potential challenges, e.g., gag reflex, limited opening. Third, considering the capabilities and limitations of the available X-ray equipment. Fourth, selecting the radiographic technique, paralleling or bisecting, that best addresses these factors while adhering to ALARA principles. And finally, ensuring proper patient positioning and exposure factors for optimal diagnostic quality and minimal radiation. Question 8. Which approach would be most appropriate for a certified restorative dental assistant, CRDA, when a patient expresses significant anxiety and requests medication to help them relax before a restorative procedure, considering the CRDA scope of practice and the need for patient safety? Option A. Prescribe a short-acting benzodiazepine to the patient, explaining its effects and potential side effects. Option B. Assess the patient's anxiety level and medical history, communicate these findings to the supervising dentist, and prepare to administer any prescribed medication under direct supervision. Option C. Advise the patient to take an over-the-counter pain reliever before their next appointment to manage potential discomfort. Option D. Independently select and administer a mild sedative from the office's stock medication to alleviate the patient's anxiety. The correct answer is B. Assess the patient's anxiety level and medical history, communicate these findings to the supervising dentist, and prepare to administer any prescribed medication under direct supervision. Explanation. This scenario presents a common challenge in restorative dental assisting, managing patient anxiety and pain effectively while adhering to strict medication protocols and ensuring patient safety. The CRDA must balance the need for patient comfort with the legal and ethical responsibilities surrounding prescription and administration of controlled substances and other medications. The professional challenge lies in accurately assessing the patient's needs, understanding the limitations of the assistant's scope of practice regarding prescription, and knowing when and how to involve the supervising dentist. The correct approach emphasizes the CRDA role in patient assessment and communication, recognizing the limitations of their prescriptive authority. This aligns with the regulatory framework for dental assistants, which typically requires direct supervision for medication administration and prohibits independent prescription. The CRDA responsibility is to gather information, communicate findings to the dentist, and prepare for the dentist's prescription and administration, or to administer under direct supervision as per protocol. This approach upholds patient safety by ensuring that all prescription decisions are made by a licensed dentist, adhering to the principle of do no harm, and complying with state dental practice acts and controlled substance regulations. An incorrect approach would involve the CRDA independently determining the need for and type of a sedative or analgesic without consulting the supervising dentist. This constitutes a significant regulatory and ethical failure. It violates the scope of practice for a dental assistant, potentially leading to the administration of inappropriate medication, adverse drug interactions, or exceeding the assistant's legal authority to prescribe or dispense. Such an action could result in disciplinary action from the dental board, legal liability for both the assistant and the dentist, and most importantly, harm to the patient. Another incorrect approach would be to administer medication without proper documentation or without confirming the prescription with the dentist, which breaches record-keeping requirements and patient safety protocols. The professional decision-making process for similar situations should involve a clear understanding of the CRDA scope of practice, established office protocols, and the dentist's preferences. When faced with a patient exhibiting anxiety or pain, the CRDA should first assess the patient's vital signs and subjective report of discomfort. This information should then be promptly communicated to the supervising dentist. The dentist will then make the clinical decision regarding the appropriate medication, dosage, and route of administration. The CRDA role is to facilitate this process by providing accurate patient information and preparing for the dentist's prescribed treatment, including administering medications under direct supervision if authorized and within their training. Question 9. The review process indicates a need to assess the CRDA competency in managing the critical steps of impression taking for a complex multi-unit bridge preparation. Which of the following actions best demonstrates adherence to CRDA regulatory framework and best practices for this specific prosthodontic procedure? Option A. Utilizing a stock tray with a general-purpose impression material, prioritizing speed to minimize patient chair time, and proceeding directly to disinfection. Option B. Selecting a high-viscosity impression material and carefully loading the tray to ensure complete capture of all preparation margins and interproximal areas, followed by thorough disinfection. Option C. Using a low-viscosity material for ease of manipulation and then trimming excess material from the impression to improve its appearance before disinfection. Option D. Relying solely on the dentist's verbal instructions for material selection and technique, without independently verifying the suitability of the chosen materials for the specific bridge preparation. The correct answer is B. Selecting a high-viscosity impression material and carefully loading the tray to ensure complete capture of all preparation margins and interproximal areas, followed by thorough disinfection. Explanation. Scenario analysis. This scenario presents a common challenge in restorative dentistry, where the dental assistant must accurately capture the patient's oral anatomy for a complex prosthodontic restoration. The challenge lies in ensuring the impression material accurately records all critical details, including margins, undercuts, and the relationship between teeth, without distortion or voids. Failure to do so can lead to ill-fitting restorations, patient discomfort, and the need for remakes, impacting both patient care and practice efficiency. The CRDA must demonstrate proficiency in material selection, technique, and patient management to achieve a diagnostically acceptable impression. Correct approach analysis. The correct approach involves selecting an appropriate impression material based on the specific restorative procedure, e.g., a crown preparation requiring high detail, and the dentist's preferred technique. This includes proper mixing and loading of the material into the tray, careful seating of the tray in the patient's mouth to ensure complete coverage and minimal distortion, and allowing adequate setting time. The CRDA role is to meticulously follow the dentist's instructions and establish protocols for impression taking, ensuring the impression is free of defects and accurately reflects the prepared tooth and surrounding structures. This aligns with the CRDA responsibility to assist in restorative procedures by providing accurate diagnostic information, as outlined in the scope of practice for CRDA, which emphasizes the importance of precise clinical data for successful treatment outcomes. Incorrect approaches analysis. One incorrect approach involves using a material that is not suitable for the specific restorative need, such as using a less viscous material for a crown preparation where high detail is paramount. This could lead to an impression that does not accurately capture the fine margins of the preparation, resulting in a poorly fitting crown. This failure violates the CRDA duty to assist in providing quality patient care by not utilizing the most appropriate tools and materials for the procedure. Another incorrect approach is to rush the impression-taking process, leading to incomplete seating of the tray, air entrapment, or premature removal of the impression before it has fully set. This would result in a distorted or incomplete impression, rendering it unusable for fabricating a crown or bridge. This directly contravenes the CRDA ethical obligation to perform duties with diligence and precision, ensuring patient safety and the efficacy of treatment. A third incorrect approach is to fail to properly disinfect the impression before handing it to the laboratory or dentist. This poses a significant infection control risk, potentially transmitting pathogens between the patient, the dental office, and the laboratory. This is a direct violation of infection control regulations and ethical standards for healthcare professionals, jeopardizing the health of all involved. Professional reasoning. When faced with impression taking for prosthodontic procedures, the CRDA should first confirm the specific requirements of the procedure with the dentist. This includes understanding the type of restoration, the preparation design, and any specific material preferences. The CRDA should then select the most appropriate impression material and tray, ensuring they are properly prepared. During the procedure, meticulous attention to detail, proper technique, and patient comfort are essential. Post-impression, thorough inspection for accuracy and defects, followed by proper disinfection, are critical steps. This systematic approach ensures that the impression serves its intended diagnostic and fabrication purpose effectively and ethically, upholding the standards of the CRDA certification. Question 10. The analysis reveals that a patient undergoing a routine restorative procedure suddenly exhibits signs of a severe allergic reaction, including hives, difficulty breathing, and a sudden drop in blood pressure. The dentist is momentarily occupied with another patient in an adjacent operatory. As a certified restorative dental assistant, CRDA, what is the most appropriate immediate course of action to manage this medical emergency? Option A. Attempt to administer an antihistamine from the emergency drug kit to alleviate the hives before administering other treatments. Option B. Immediately administer epinephrine from the emergency drug kit as per standing orders, while simultaneously directing another staff member to call emergency medical services. Option C. Administer oxygen to the patient and monitor their breathing closely, assuming the symptoms might resolve on their own. Option D. Wait for the dentist to finish their current task and come to the operatory to assess the patient before initiating any treatment. The correct answer is B. Immediately administer epinephrine from the emergency drug kit as per standing orders, while simultaneously directing another staff member to call emergency medical services. Explanation. Scenario analysis. This scenario is professionally challenging because it requires immediate, decisive action in a high-stress situation where a patient is experiencing a severe medical emergency. The CRDA must accurately assess the situation, recall and apply emergency protocols, and administer appropriate care while awaiting advanced medical support. Failure to act promptly and correctly can have life-threatening consequences for the patient. The CRDA role is critical in stabilizing the patient and providing essential interventions. Correct approach analysis. The correct approach involves recognizing the signs of anaphylaxis, immediately activating the office emergency protocol, administering epinephrine as per standing orders or direct supervision, and ensuring the patient receives advanced medical care by calling emergency services. This aligns with the CRDA scope of practice and the established guidelines for managing medical emergencies in a dental setting, emphasizing prompt intervention with life-saving medication. Regulatory frameworks for dental assistants typically mandate preparedness for medical emergencies and outline the scope of their responsibilities in such events, including the administration of emergency medications under specific conditions. Incorrect approaches analysis. One incorrect approach would be to delay administering epinephrine, perhaps by waiting for the dentist's direct, immediate instruction if standing orders are in place, or by attempting to manage the symptoms with less effective measures first. This delay violates the principle of immediate intervention crucial for anaphylaxis, potentially leading to a more severe or fatal outcome. Ethically and regulatorily, this failure to act swiftly when a life-saving intervention is indicated and authorized constitutes negligence. Another incorrect approach would be to administer medication other than epinephrine without clear standing orders or direct supervision for that specific medication in this context. This could be inappropriate for anaphylaxis and may delay or interfere with the correct treatment. It also exceeds the typical scope of practice for a CRDA unless specifically authorized and trained for such interventions, potentially leading to regulatory violations and patient harm. A further incorrect approach would be to fail to call for advanced medical assistance e.g. 911/emergency services promptly. While the CRDA can provide initial care, the severity of anaphylaxis necessitates immediate transport to a hospital for further evaluation and treatment. Delaying this call means the patient misses out on critical hospital-based care, which is a significant failure in patient management and a breach of professional responsibility. Professional reasoning. Professionals should employ a decision-making framework that prioritizes patient safety and adheres to established emergency protocols. This involves 1. Rapid assessment. Quickly identify the signs and symptoms of a medical emergency. 2. Protocol activation. Immediately initiate the dental office's emergency action plan. 3. Intervention. Administer appropriate pre-authorized interventions like epinephrine for anaphylaxis without undue delay. 4. Communication. Alert the dentist and call for advanced medical support. 5. Monitoring. Continuously monitor the patient's condition until advanced medical personnel arrive. This systematic approach ensures that critical steps are not missed and that the patient receives the best possible immediate care within the CRDA scope of practice. Question 11. System analysis indicates a dentist is performing root canal therapy on a mandibular molar. During the irrigation phase, the dental assistant is responsible for preparing and delivering the irrigant. The dentist requests the irrigant to be delivered to the canal. Considering CRDA guidelines for endodontic assisting and patient safety, what is the most appropriate action for the dental assistant to take to ensure effective irrigation and minimize risks? Option A. Prepare a syringe with a sharp hypodermic needle and insert it deeply into the canal to ensure maximum irrigant penetration. Option B. Prepare a syringe with a blunt-tipped needle, ensuring the needle is not fully inserted into the canal, and actively withdraw the syringe as the irrigant is dispensed to facilitate debris removal. Option C. Prepare a syringe with a blunt-tipped needle and inject the irrigant rapidly and forcefully into the canal without withdrawing the syringe. Option D. Prepare a syringe with a blunt-tipped needle and hand it to the dentist to administer the irrigant themselves, without any further assistance. The correct answer is B. Prepare a syringe with a blunt-tipped needle, ensuring the needle is not fully inserted into the canal, and actively withdraw the syringe as the irrigant is dispensed to facilitate debris removal. Explanation. This scenario presents a common challenge in endodontic procedures, maintaining a sterile field and ensuring proper irrigation during root canal therapy, which directly impacts the success of the treatment and patient safety. The assistant's role is critical in anticipating the dentist's needs and executing tasks with precision to prevent contamination and ensure adequate debridement and disinfection of the root canal system. Adherence to established protocols and understanding the rationale behind each step are paramount. The correct approach prioritizes patient safety and treatment efficacy by strictly adhering to the established protocol for irrigant delivery and management. This involves using a designated irrigating syringe with a blunt-tipped needle, ensuring the needle is not fully inserted into the canal to prevent extrusion beyond the apex, and actively withdrawing the syringe during irrigation to facilitate removal of debris and irrigant. This method aligns with CRDA guidelines for infection control and instrument handling, minimizing the risk of iatrogenic injury and ensuring thorough disinfection, which is a cornerstone of successful root canal therapy. An incorrect approach would involve using a sharp needle, which poses a significant risk of periapical tissue damage and potential systemic spread of infection. Another incorrect approach would be to insert the needle deeply into the canal without active withdrawal, leading to inadequate debris removal and potential extrusion of irrigant and microorganisms beyond the apex, compromising the healing process and potentially causing post-operative pain or complications. Failing to use a blunt-tipped needle or not actively withdrawing the syringe during irrigation are direct violations of best practices for infection control and patient safety, as outlined in CRDA standards for assisting in endodontic procedures. These failures can lead to adverse patient outcomes and professional disciplinary action. Professionals should approach such situations by first understanding the critical role of each step in the procedure. They must anticipate the dentist's needs, maintain a clear mental model of the sterile field, and execute tasks with precision. This involves continuous learning and adherence to CRDA regulations and ethical guidelines, recognizing that deviations can have serious consequences for patient care. A systematic approach, focusing on asepsis, proper technique, and patient well-being, is essential for effective and safe dental assisting. Question 12. Stakeholder feedback indicates that during a routine periodontal maintenance appointment, a patient expresses significant discomfort despite the administration of local anesthetic. The Certified Restorative Dental Assistant, CRDA, is preparing instruments for scaling and root planing. What is the most appropriate immediate action for the CRDA to take? Option A. Immediately stop the procedure and reschedule the appointment for a later date without further assessment. Option B. Inform the patient that discomfort is expected during periodontal maintenance and continue with instrument preparation. Option C. Proceed with scaling and root planing, assuming the patient's discomfort is minor and will subside as the procedure progresses. Option D. Pause the procedure, reassess the patient's comfort level, and communicate with the supervising dentist to determine if additional anesthetic is needed or if the treatment plan requires adjustment. The correct answer is D. Pause the procedure, reassess the patient's comfort level, and communicate with the supervising dentist to determine if additional anesthetic is needed or if the treatment plan requires adjustment. Explanation: this scenario is professionally challenging because it requires the Certified Restorative Dental Assistant, CRDA, to balance immediate patient comfort and procedural efficiency with the long-term implications of periodontal health and the strict adherence to infection control protocols mandated by the CRDA regulatory framework. The CRDA must make a judgment call that impacts both the patient's experience and the integrity of the treatment. The correct approach represents best professional practice because it prioritizes patient safety and adherence to established clinical protocols by thoroughly assessing the patient's comfort level and ensuring adequate anesthesia before proceeding with the periodontal procedure. The CRDA upholds the ethical obligation to do no harm and the regulatory requirement for safe patient care. This proactive approach minimizes the risk of patient distress, potential complications arising from inadequate pain management, and ensures the procedure can be completed effectively, contributing to better long-term periodontal health outcomes. This aligns with the CRDA responsibility to assist the dentist in providing high-quality restorative and periodontal care within the scope of their practice. An incorrect approach that involves proceeding with the procedure, despite the patient's expressed discomfort and potential for inadequate anesthesia, represents a failure to adhere to fundamental patient care standards. This could lead to patient anxiety, potential for involuntary movement during the procedure, and a compromised treatment outcome, all of which are contrary to the CRDA ethical and regulatory duties. Another incorrect approach, such as delaying the procedure indefinitely without proper communication or reassessment, could negatively impact the patient's periodontal health and disrupt the dental practice's schedule, failing to meet the professional obligation for timely and effective care. Lastly, attempting to push through the discomfort without addressing the root cause of the patient's unease or ensuring adequate anesthesia would be a direct violation of patient welfare principles and could be construed as negligence, a serious regulatory and ethical breach. Professionals should employ a systematic decision-making process that begins with active listening to the patient's concerns. This should be followed by a clinical assessment of the situation, e.g., evaluating the effectiveness of the anesthetic. Based on this assessment, the professional should consult with the supervising dentist if necessary, and then implement the most appropriate course of action that prioritizes patient safety, comfort, and the successful completion of the procedure according to established protocols. Question 13. During the evaluation of a patient who has just undergone a routine mandibular molar extraction, what is the most appropriate set of post-operative instructions to provide to ensure optimal healing and patient safety, adhering strictly to CRDA guidelines? Option A. Emphasize the importance of keeping the surgical site dry and avoiding any oral hygiene practices for the first 48 hours, and advise them to only consume liquids until their follow-up appointment. Option B. Provide a written pamphlet on general oral surgery care, tell the patient to keep the surgical area clean, and instruct them to return in 2 weeks for a follow-up appointment without detailing specific immediate care measures. Option C. Inform the patient that pain medication has been prescribed and they should take it as needed. Suggest they can resume normal eating habits once they feel comfortable, and mention that they should call if they experience severe pain. Option D. Advise the patient on managing pain with prescribed medication. Explain the importance of rest and avoiding strenuous activity. Detail dietary recommendations such as soft foods, and clearly outline signs of complications like excessive bleeding or infection, along with instructions on when to contact the dental office. The correct answer is D. Advise the patient on managing pain with prescribed medication. Explain the importance of rest and avoiding strenuous activity. Detail dietary recommendations such as soft foods, and clearly outlines signs of complications like excessive bleeding or infection, along with instructions on when to contact the dental office. Explanation. This scenario presents a common challenge in restorative dental assisting, where immediate post-operative care directly impacts patient recovery and satisfaction. The professional challenge lies in accurately assessing the patient's immediate needs and providing clear, actionable instructions that align with the dentist's treatment plan and established clinical protocols, while also ensuring patient comprehension and safety. The restorative dental assistant must balance the need for efficient patient discharge with thoroughness in instruction to prevent complications. The correct approach represents best professional practice because it prioritizes patient education and safety, which are fundamental ethical and regulatory obligations in dental assisting. Providing comprehensive post-operative instructions, including clear explanations of what to expect, signs of complications, and appropriate management strategies, empowers the patient to actively participate in their recovery. This aligns with the CRDA responsibility to support the dentist in delivering quality patient care and adhering to established standards of practice, ensuring that the patient understands the critical steps for healing and when to seek further professional help. This proactive approach minimizes the risk of adverse outcomes and reduces the likelihood of unnecessary follow-up calls or emergency visits. An incorrect approach that fails to adequately explain the use of prescribed pain medication is professionally unacceptable. This omission could lead to patient misuse or underuse of medication, potentially resulting in uncontrolled pain, increased anxiety, and a negative patient experience. Ethically, it violates the principle of patient autonomy by not providing sufficient information for informed decision-making regarding their pain management. From a regulatory standpoint, it could be considered a failure to provide adequate post-operative care as expected under general dental practice guidelines. Another incorrect approach that neglects to detail specific dietary restrictions and oral hygiene modifications post-extraction is also professionally deficient. Without this guidance, patients may inadvertently cause trauma to the surgical site through inappropriate food choices or improper cleaning techniques, leading to delayed healing, infection, or bleeding. This failure to provide essential care instructions undermines the patient's ability to maintain oral health during the critical healing period and could be viewed as a breach of the duty of care. A third incorrect approach that does not clearly outline the signs and symptoms of potential complications, such as excessive bleeding, swelling, or infection, and the immediate steps to take if they occur, is critically flawed. This lack of information leaves the patient vulnerable and unprepared to recognize and respond to serious issues, potentially delaying necessary intervention and exacerbating negative outcomes. This omission represents a significant ethical lapse in patient safety and a failure to uphold the professional standard of care expected of a CRDA. Professional decision-making process for similar situations should involve a structured approach. First, thoroughly review the dentist's post-operative orders and any specific instructions for the procedure performed. Second, anticipate potential patient questions and concerns related to pain, swelling, bleeding, diet, and oral hygiene. Third, deliver instructions clearly and concisely, using language the patient can understand, and encourage them to ask questions. Fourth, confirm patient comprehension by asking them to reiterate key instructions. Finally, document the instructions provided in the patient's record. Question 14. System analysis indicates that a dentist is preparing a Class Roman II composite resin restoration. The assistant has dispensed the composite material and is preparing to assist in its placement. Considering the inherent properties of composite resins and the critical need for a successful, long-lasting restoration, which of the following actions by the assistant would best support the dentist and ensure the integrity of the restoration? Option A. Mix the composite material with the bonding agent in the assistant's well before presenting it to the dentist. Option B. Proceed with placing the composite material immediately after dispensing, assuming the dentist will manage any moisture contamination. Option C. Light cure the composite material for an extended period to ensure complete polymerization, regardless of the manufacturer's recommended time. Option D. Ensure the preparation is meticulously isolated from moisture and air, using a dental dam before the composite is placed. The correct answer is D. Ensure the preparation is meticulously isolated from moisture and air using a dental dam before the composite is placed. Explanation. Scenario analysis. This scenario presents a common challenge in restorative dentistry, where the selection and manipulation of dental materials directly impact the longevity and success of a restoration. The dentist relies on the Certified Restorative Dental Assistant, CRDA, to possess the knowledge and skill to prepare and deliver these materials accurately. The challenge lies in understanding the nuanced properties of different restorative materials and their appropriate handling to achieve optimal clinical outcomes while adhering to CRDA scope of practice and best practices. Correct approach analysis. The correct approach demonstrates a thorough understanding of composite resin properties, specifically its sensitivity to moisture and air. Proper isolation techniques, such as using a dental dam, are critical to prevent contamination, which can compromise the bond strength and overall integrity of the composite restoration. This aligns with CRDA responsibilities to assist in procedures that require meticulous material handling and patient safety, ensuring the restoration meets the manufacturer's specifications and clinical expectations for durability and aesthetics. Incorrect approaches analysis. One incorrect approach involves proceeding with the restoration without adequate moisture control. This directly violates best practices for composite resin application. Contamination with saliva or blood can lead to a weak bond between the composite and the tooth structure, resulting in premature failure, recurrent decay, or post-operative sensitivity. Ethically, this constitutes a failure to provide competent care, potentially harming the patient. Another incorrect approach is to overcure the composite material. While curing is essential, excessive curing can lead to brittleness and increased stress within the restoration, making it more prone to fracture. This demonstrates a lack of understanding of the material's photopolymerization process and its impact on mechanical properties, falling outside the scope of expected CRDA proficiency. A third incorrect approach is to mix the composite resin with a bonding agent before application. Composite resins are typically applied directly to the prepared tooth surface after the bonding agent has been applied and light cured. Premixing can alter the viscosity and working time of the composite, potentially leading to an incomplete or poorly adapted restoration. This indicates a fundamental misunderstanding of the sequential steps in composite restoration placement and material interaction. Professional reasoning. Professionals should approach material selection and manipulation by first consulting the manufacturer's instructions for use (IFU) for each specific dental material. This is paramount as material properties and handling techniques can vary significantly between brands and types. Following the IFU ensures adherence to recommended protocols for mixing, application, curing, and finishing, which are designed to optimize the material's performance and patient outcomes. Furthermore, ongoing professional development and staying abreast of advancements in dental materials and techniques are crucial for maintaining competency and providing the highest standard of care within the CRDA scope of practice. Question 15. The monitoring system demonstrates that the dental assistant has completed the following steps in preparation for a Class Roman II composite restoration. The patient has been seated and draped, the correct shade of composite has been selected, and the dental unit has been prepared with suction and air/water syringe. However, the assistant has not yet confirmed the patient's understanding of the procedure or initiated the setup of the instrument tray and isolation method. Which of the following actions represents the most appropriate next step in adhering to regulatory and best practice standards for a certified restorative dental assistant? Option A. Focus on suction and air/water syringe readiness, assuming the dentist will request instruments as needed. Option B. Immediately begin the procedure by handing the dentist the explorer and mirror to start the examination. Option C. Ask the patient if they are ready for the procedure to begin without further preparation. Option D. Proceed with assembling the instrument tray and selecting the appropriate isolation technique, such as a rubber dam, to ensure a dry field. The correct answer is D. Proceed with assembling the instrument tray and selecting the appropriate isolation technique, such as a rubber dam, to ensure a dry field. Explanation. Scenario analysis. This scenario presents a common challenge in restorative dental assisting, ensuring patient comfort and safety while maintaining a sterile field and optimal working conditions for the dentist. The potential for aspiration or ingestion of foreign objects, the need for effective isolation to prevent contamination and ensure material integrity, and the importance of efficient instrument transfer are all critical aspects of restorative procedures. Failure in any of these areas can lead to patient harm, procedural complications, and regulatory noncompliance. Correct approach analysis. The correct approach prioritizes patient safety and procedural efficacy through meticulous preparation and execution. This involves confirming the patient's understanding and comfort, assembling the correct armamentarium and materials, and employing appropriate isolation techniques. The use of a rubber dam, when indicated, is a cornerstone of infection control and moisture control, directly contributing to the success of restorative materials and preventing aspiration. Proper instrument transfer minimizes the risk of contamination and ensures the dentist has immediate access to necessary tools, thereby streamlining the procedure and enhancing patient safety. This aligns with the CRDA responsibility to assist in procedures safely and effectively, adhering to established protocols for patient care and infection control. Incorrect approaches analysis. An approach that bypasses pre-procedure patient confirmation and proceeds directly to tray setup without verifying patient status or understanding of the procedure is a failure in patient-centered care and informed consent principles. It neglects the ethical obligation to ensure the patient is prepared and comfortable, potentially leading to anxiety or unexpected reactions. An approach that involves a hasty or incomplete tray setup, omitting essential instruments or materials, directly compromises the efficiency and safety of the procedure. This can lead to delays, increased chair time, and potential contamination of instruments if items are retrieved mid-procedure. It demonstrates a lack of preparedness and attention to detail, which are fundamental to professional practice. An approach that neglects to establish adequate moisture control, such as relying solely on cotton rolls when a rubber dam is indicated for procedure requiring absolute dryness, risks the integrity of restorative materials. This can lead to premature failure of the restoration, requiring additional treatment and potentially impacting patient satisfaction and oral health. It also increases the risk of aspiration of debris or small instruments. Professional reasoning. When faced with a restorative procedure, the professional decision-making process should begin with a thorough review of the patient's chart and the planned treatment. This is followed by a clear and concise explanation of the procedure to the patient, addressing any concerns and obtaining their consent. Next, the assistant must meticulously prepare the operatory, including the correct tray setup with all necessary instruments and materials, ensuring they are sterile. The selection and application of appropriate isolation techniques, such as rubber dam or cotton rolls, are crucial for maintaining a dry field and preventing aspiration. Finally, efficient and safe instrument transfer, coupled with continuous monitoring of the patient's comfort and the operative field, ensures a successful and safe outcome. This systematic approach, grounded in patient safety, infection control, and procedural best practices, is essential for CRDA professionals. Question 16. Regulatory review indicates that a patient scheduled for a restorative procedure appears visibly anxious and has a documented history of controlled hypertension. The dental assistant is tasked with explaining the procedure, its benefits, and potential risks. Which of the following approaches best aligns with CRDA best practices for patient management and communication in this scenario? Option A. Proceed with a detailed, technical explanation of the restorative procedure, assuming the patient will ask questions if they have concerns, and briefly mention that their hypertension is noted. Option B. Acknowledge the patient's anxiety with a reassuring statement, then provide a clear, simplified explanation of the procedure, focusing on the benefits and addressing potential risks in a way that minimizes their perceived severity, while also noting the importance of their controlled hypertension for treatment. Option C. Postpone the explanation until the patient appears less anxious, and then provide a brief overview of the procedure, focusing only on the immediate steps involved. Option D. Empathetically acknowledge the patient's anxiety, actively listen to their specific concerns, and then explain the restorative procedure using clear, understandable language, integrating relevant information about their controlled hypertension and its implications for the treatment, while encouraging questions throughout. The correct answer is A. Proceed with a detailed, technical explanation of the restorative procedure, assuming the patient will ask questions if they have concerns, and briefly mention that their hypertension is noted. Explanation. Scenario analysis. This scenario presents a common challenge in restorative dental assisting, effectively communicating complex treatment information to a patient who exhibits signs of anxiety and has a history of medical conditions that could impact dental treatment. The assistant must balance the need for thorough patient education with the patient's emotional state and medical considerations, ensuring informed consent and a safe, comfortable experience. Correct approach analysis. The correct approach prioritizes a calm, empathetic, and comprehensive communication strategy. It involves actively listening to the patient's concerns, validating their anxiety, and then tailoring the explanation of the restorative procedure to their understanding, while also acknowledging and integrating relevant medical history. This aligns with CRDA best practices for patient management, emphasizing patient-centered care, informed consent, and the assistant's role in facilitating a positive patient experience. Specifically, it upholds the ethical obligation to ensure patients understand their treatment options and risks, and to provide care that is sensitive to their individual needs and medical status. Incorrect approaches analysis. One incorrect approach might involve rushing through the explanation without addressing the patient's visible anxiety. This fails to meet the CRDA standard for patient communication and anxiety management, potentially leading to a lack of understanding, increased patient distress, and a compromised treatment outcome. Ethically, it breaches the duty of care by not ensuring the patient is truly informed and comfortable. Another incorrect approach could be to solely focus on the technical aspects of the procedure, ignoring the patient's medical history and anxiety. This is a significant regulatory and ethical failure. It disregards the CRDA responsibility to consider all factors influencing patient care, including medical contraindications or necessary modifications due to health conditions. It also neglects the importance of building trust and rapport, which is crucial for effective patient management. A third incorrect approach might be to oversimplify the explanation to the point of omitting crucial details about the procedure, risks, or alternatives, simply to appease an anxious patient. While well-intentioned, this undermines the principle of informed consent, a cornerstone of dental practice. The CRDA has a duty to provide accurate and complete information, allowing the patient to make a truly informed decision, even if it requires more time and careful explanation. Professional reasoning. When faced with a patient exhibiting anxiety and with a relevant medical history, the restorative dental assistant should first acknowledge and validate the patient's feelings. This can be achieved through empathetic listening and reassuring statements. Next, the assistant should review the patient's medical history to identify any potential implications for the proposed restorative treatment. The explanation of the procedure should then be delivered in clear, understandable language, avoiding jargon, and tailored to the patient's apparent level of comprehension. Opportunities for the patient to ask questions should be actively encouraged throughout the process. If anxiety remains a significant barrier, the assistant should consider discussing potential anxiety management strategies with the patient and the supervising dentist. The ultimate goal is to ensure the patient feels heard, understood, safe, and fully informed before proceeding with treatment. Question 17. Risk assessment procedures indicate a new patient presence with generalized wear on the occlusal surfaces of several posterior teeth, and the dentist has requested a comprehensive assessment of their dentition. As a certified restorative dental assistant, which of the following actions best supports the dentist's diagnostic and treatment planning process, ensuring adherence to CRDA standards for patient care and documentation? Option A. Systematically chart all teeth present, noting any missing teeth, and record the specific tooth surfaces exhibiting wear using the universal numbering system, while also describing the occlusal relationship and any observable signs of TMJ dysfunction. Option B. Document the presence of wear on the posterior teeth by simply noting worn teeth in the patient's chart without specifying individual teeth or the nature of the wear. Option C. Focus on identifying and charting only the anterior teeth and their incisal edges, as these are most visible, and assume the posterior tooth wear is a minor issue. Option D. Visually estimate the extent of wear on the most prominent posterior teeth and verbally relay this observation to the dentist, focusing primarily on the aesthetic impact. Correct answer is A. Systematically chart all teeth present, noting any missing teeth, and record the specific tooth surfaces exhibiting wear using the universal numbering system, while also describing the occlusal relationship and any observable signs of TMJ dysfunction. Explanation. This scenario presents a professional challenge due to the need to accurately identify and document a patient's dental anatomy and occlusion, which are foundational to effective restorative treatment planning and execution. Misinterpretation or misapplication of tooth numbering systems, or a misunderstanding of the relationship between dental arches and the temporomandibular joint, TMJ, can lead to incorrect diagnoses, inappropriate treatment plans, and ultimately compromised patient outcomes. Adherence to established CRDA regulatory frameworks and ethical guidelines is paramount to ensure patient safety and the provision of competent care. The correct approach involves a systematic and thorough assessment of the patient's dentition, utilizing the appropriate tooth numbering system, and accurately describing the morphology of the teeth, including their surfaces, pulp anatomy, and root structures. A precise understanding of occlusion and the relationship of the dental arches to the TMJ is critical for restorative success. This approach aligns with CRDA standards by emphasizing accurate data collection, proper documentation, and a comprehensive understanding of the oral structures, which directly impacts the ability to assist the dentist in providing safe and effective restorative care. This is ethically mandated by the principle of beneficence, ensuring the patient receives the best possible treatment based on accurate information. An incorrect approach that relies solely on visual approximation without employing the standardized tooth numbering system fails to meet the CRDA requirement for precise and unambiguous communication. This can lead to errors in charting, treatment planning, and communication between dental professionals, potentially violating the principle of non-maleficence by exposing the patient to unnecessary risks. Another incorrect approach that neglects to consider the occlusal relationships and TMJ function overlooks crucial aspects of restorative dentistry. Restorations must not only be aesthetically pleasing and functionally sound in isolation, but must also integrate harmoniously with the patient's entire masticatory system. Failure to do so can result in occlusal disharmony, TMJ pain, and premature failure of restorations, which is a breach of professional duty and ethical standards. A third incorrect approach that focuses only on the visible surfaces of the teeth without considering the underlying root anatomy and supporting structures, periodontium, is incomplete. The health and integrity of the periodontium are vital for the longevity of any restorative work, and ignoring these aspects can lead to treatment complications and patient harm, violating the ethical obligation to provide comprehensive care. Professional decision-making in such situations requires a systematic process. First, accurately identify the patient's presenting condition and the specific anatomical structures involved. Second, apply the appropriate standardized tools and knowledge, such as the correct tooth numbering system and principles of occlusion. Third, consider the interrelationship of all relevant anatomical components, including the teeth, arches, periodontium, and TMJ. Finally, document findings clearly and accurately, adhering to all regulatory and ethical guidelines to ensure effective communication and optimal patient care. Question 18. System analysis indicates that during a complex crown and bridge preparation, the dentist requires assistance with impression material handling and temporary crown fabrication. Simultaneously, in a separate operatory, a patient is awaiting a new denture insertion, requiring the CRDA to prepare the try-in stage. Considering the CRDA scope of practice and the need for precise execution in both scenarios, which of the following best describes the CRDA role and responsibilities? Option A. Independently select the most appropriate impression material and fabrication technique for the temporary crown based on general knowledge, and proceed with denture adjustments without direct supervision, assuming the dentist will review the work later. Option B. Focus solely on the denture insertion, as it is a more immediate patient need, and instruct the dentist to manage the crown and bridge impression materials and temporary fabrication independently, as these are less critical. Option C. Assist with both procedures simultaneously by multitasking, making independent decisions on material choices and fabrication methods for both the crown and bridge and the denture, to expedite patient treatment, without requiring specific instructions for each step. Option D. Prioritize the crown and bridge procedure by meticulously following the dentist's instructions for impression material manipulation and temporary crown fabrication, while delegating any non-critical denture preparation tasks to a dental assistant trainee, ensuring all actions remain within the CRDA certified duties and U.S. regulatory guidelines. The correct answer is D. Prioritize the crown and bridge procedure by meticulously following the dentist's instructions for impression material manipulation and temporary crown fabrication, while delegating any non-critical denture preparation tasks to a dental assistant trainee, ensuring all actions remain within the CRDA certified duties and U.S. regulatory guidelines. Explanation. This scenario presents a professional challenge due to the critical nature of prosthodontic procedures and the direct impact on patient health and function. Assisting with crown and bridge fabrication and denture fabrication requires meticulous attention to detail, adherence to established protocols, and a thorough understanding of material properties and patient anatomy. The CRDA role is to support the dentist, ensuring that all steps are performed accurately and safely within the scope of their certification. Careful judgment is required to anticipate the dentist's needs, maintain a sterile field, and handle materials appropriately to prevent errors that could compromise the final restoration or patient well-being. The correct approach represents best professional practice because it prioritizes patient safety and the integrity of the prosthodontic treatment by adhering strictly to the dentist's instructions and the established CRDA scope of practice as defined by the relevant U.S. regulatory framework for dental assisting. This includes understanding the specific materials being used, their handling requirements, and the precise steps involved in fabricating or assisting with the fabrication of crowns, bridges, and dentures. This approach ensures that the CRDA is acting within their authorized duties, contributing effectively to the treatment plan, and upholding ethical standards of care. Incorrect approaches fail to meet professional standards and may violate regulatory guidelines. One incorrect approach might involve improvising or making assumptions about material handling or procedural steps without direct instruction from the dentist. This constitutes a failure to adhere to the dentist's directive and potentially a breach of the CRDA scope of practice, as it could lead to the use of incorrect materials, improper mixing, or flawed fabrication techniques, all of which compromise the quality and fit of the prosthesis and could harm the patient. Such actions could also be seen as practicing dentistry without a license, a serious regulatory violation. Another incorrect approach could be neglecting to maintain a sterile or aseptic field during critical stages of fabrication or preparation. This directly violates infection control protocols mandated by dental regulatory bodies and CRDA certification standards, increasing the risk of post-operative complications for the patient. Furthermore, failing to accurately record or communicate observations regarding material consistency or procedural progress to the dentist could lead to misinterpretations and errors in the final restoration. The professional decision-making process for similar situations should involve a clear understanding of the CRDA-defined scope of practice, a commitment to following the dentist's specific instructions for each procedure, and a proactive approach to patient safety and infection control. When in doubt about any aspect of a procedure, the CRDA must seek clarification from the supervising dentist rather than proceeding with assumptions. This ensures that all actions are within the bounds of their certification and contribute positively to the patient's restorative dental care. Question 19. Implementation of a restorative dental procedure is underway, and the dentist requests an assessment of the integrity of a recently placed composite restoration. The dental assistant needs to select the most appropriate hand instrument to provide tactile feedback regarding the restoration's margins and surface texture. Which instrument is best suited for this diagnostic task? Option A, a dental mirror. Option B, a handpiece with a finishing burr. Option C, a plastic filling instrument. Option D, an explorer with a fine, sharp tip. The correct answer is D, an explorer with a fine, sharp tip. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the dental assistant to balance immediate patient care needs with the critical requirement of maintaining sterile and functional equipment. The urgency of a patient's discomfort can create pressure to bypass established protocols, but doing so risks cross-contamination, instrument damage, and potential regulatory noncompliance. Accurate identification and appropriate use of hand instruments are fundamental to restorative procedures, and their proper maintenance directly impacts patient safety and treatment efficacy. Correct approach analysis. The correct approach prioritizes patient safety and adherence to established protocols for instrument selection and use. Selecting an explorer to assess the depth and integrity of a restoration is a standard procedure. The explorer's sharp, fine tip is designed for tactile feedback, allowing the assistant to detect irregularities, undercuts, or caries that a blunt instrument would miss. This aligns with the CRDA responsibility to assist in diagnosis and treatment planning by providing accurate information to the dentist. Furthermore, ensuring the instrument is clean and properly sterilized before use is a non-negotiable regulatory and ethical requirement to prevent the transmission of infectious agents. Incorrect approach is analysis. Choosing a blunt instrument, such as a plastic filling instrument, to assess the integrity of a restoration is incorrect because it lacks the necessary tactile sensitivity. This could lead to a misdiagnosis of recurrent decay or a defective margin, potentially compromising the restoration's longevity and the patient's oral health. Ethically, this represents a failure to provide competent care. Using a dental mirror to assess the integrity of a restoration without first using an explorer is incorrect because a mirror is primarily for visualization and indirect vision, not for tactile assessment of surface irregularities or depth. Useful for seeing difficult-to-reach areas, it cannot provide the detailed tactile information an explorer can. This approach fails to utilize the appropriate instrument for the diagnostic task, potentially leading to an incomplete assessment. Attempting to assess the restoration's integrity with a handpiece and burr is fundamentally incorrect and dangerous. Handpieces and burrs are cutting instruments designed for tooth preparation and material removal, not for diagnostic assessment of existing restorations. Using a burr for this purpose could inadvertently damage the existing restoration, the surrounding tooth structure, or even injure the patient. This constitutes a severe breach of professional conduct and patient safety protocols. Professional reasoning. Professionals should approach such situations by first identifying the specific diagnostic need. In this case, it's assessing the integrity of a restoration. Then, they must recall the function and design of available instruments. Explorers are specifically designed for tactile exploration of tooth surfaces and restorations. If the instrument is not readily available or is suspected of being compromised, the professional's next step should be to follow established protocols for obtaining a sterile instrument or reporting the issue, rather than improvising with an inappropriate tool. This systematic approach ensures that patient care is delivered safely and effectively, adhering to all regulatory and ethical standards. Question 20. Compliance review shows that a patient, 2 days post-oral surgery, contacts the dental office reporting increased swelling, redness, and a foul odor emanating from the surgical site. The Certified Restorative Dental Assistant, CRDA, is the first to receive the call. Which of the following actions best adheres to the CRDA scope of practice and ethical responsibilities in this situation? Option A. Recommend that the patient go to the nearest emergency room for immediate evaluation and treatment. Option B. Advise the patient to continue with warm salt water rinses and to call back in 24 hours if symptoms do not improve. Option C. Immediately inform the operating dentist of the patient's reported symptoms and await further instructions. Option D. Instruct the patient to begin taking a leftover antibiotic prescription from a previous dental issue. The correct answer is B. Advise the patient to continue with warm salt water rinses and to call back in 24 hours if symptoms do not improve. Explanation. Scenario analysis. This scenario presents a common challenge in oral and maxillofacial surgery settings, managing postoperative wound care for a patient experiencing signs of infection. The CRDA role is critical in recognizing these signs and initiating the appropriate response, balancing patient well-being with adherence to established protocols and the dentist's orders. The challenge lies in accurately assessing the situation, understanding the scope of the CRDA responsibilities, and acting decisively within those boundaries to ensure patient safety and prevent complications. Correct approach analysis. The correct approach involves immediate and direct communication with the operating dentist. This aligns with the CRDA scope of practice, which mandates reporting any deviations from expected postoperative healing to the supervising dentist. The dentist is ultimately responsible for diagnosing and treating complications. Promptly informing the dentist allows for timely assessment, diagnosis, and the initiation of appropriate treatment, such as prescribing antibiotics or scheduling a follow-up appointment. This upholds the principle of patient safety and ensures that care is delivered by the licensed professional with the authority to make medical decisions. This approach is consistent with the ethical obligation to act in the patient's best interest and within the defined scope of practice for a certified restorative dental assistant. Incorrect approaches analysis. One incorrect approach involves advising the patient to simply rinse with warm salt water and monitor the situation. This is professionally unacceptable because it constitutes providing medical advice and treatment recommendations without the authority of the operating dentist. It delays necessary professional evaluation and could allow a developing infection to worsen, potentially leading to more severe complications. This action exceeds the CRDA scope of practice and violates the ethical duty to refer to the appropriate licensed professional. Another incorrect approach is to immediately prescribe an antibiotic. This is a significant regulatory and ethical failure. Prescribing medication is exclusively within the purview of a licensed dentist or physician. A CRDA lacks the legal authority and clinical judgment to diagnose an infection and select an appropriate antibiotic. Doing so would constitute practicing dentistry without a license and would put the patient at risk of adverse drug reactions, antibiotic resistance, and ineffective treatment. A third incorrect approach is to instruct the patient to seek care from an emergency room without first consulting the operating dentist. While seeking emergency care might eventually be necessary, bypassing the operating dentist, who has the patient's full surgical history and is responsible for their post-operative care, is not the most efficient or appropriate first step. The operating dentist may have specific post-operative protocols or be able to manage the situation in their office, avoiding unnecessary ER visits and associated costs for the patient. This approach fails to leverage the existing patient-provider relationship and the dentist's expertise in managing their own surgical outcomes. Professional reasoning. When faced with a post-operative complication, a CRDA should follow a structured decision-making process. First, observe and document the patient's reported symptoms and any visible signs. Second, assess whether these findings are within the expected range of post-operative healing or if they suggest a complication. Third, if a complication is suspected, immediately report the findings to the supervising dentist. Fourth, await and follow the dentist's specific instructions for patient management. This process ensures that patient care remains within the legal and ethical boundaries of the CRDA role, prioritizing patient safety and effective treatment.